and do not let people bully you into different things. I have been asked a couple of times to do bariatric surgery. This has never happened to me before. Hi everyone, and today we're going to be talking about PCOS and hair removal. Especially, I recently just started a journey with hair removal, and I would like to just focus more about that. First, I'm going to be telling you a little bit about what PCOS is. I remember when I was diagnosed when I was 13. My doctor wasn't like, I didn't really have a good experience with like my diagnosis. I think I got diagnosed and I got a pamphlet, and they're like, basically go deal with it by yourself. So first we're going to talk about what PCOS is. If you don't already know, I'm sure if you clicked on this video you already know what it stands for. It basically means Polycystic Ovarian Syndrome. Polycystic Ovarian Syndrome is a syndrome that commonly affects people with ovaries, and it is hormonal and basically affects people within the reproductive age. It's common in, I think, 1 in 10 women. It is still undiagnosed and misunderstood. Basically, PCOS messes up with your hormones. We have the ovaries, as you know, a reproductive organ. Your ovaries are making too many androgens. These are the male hormones. I'm sorry if you see me reading, I'm reading the script. Also, this prevents your eggs from fully developing or being released during ovulation. This leads to tiny fluid-filled cysts. They aren't harmful, but they disrupt your normal cycle. Doctors usually use a criteria called a Rotherham criteria. Basically, it's a triad of 3 symptoms, and you need 2 out of 3 if you're like older than, I think, 18 or 19, but in your teenage years you need to be 3 out of 3. So the first one is irregular or no periods, which is called oligo or anovulation. High levels of androgens, which will cause symptoms like hair growth, like excessively, like hirsutism, and polycystic ovaries on an ultrasound. I think you need, about 3 or 4 cysts on the ovaries to be counted as a polycystic ovary. Also, the doctor will have to rule out a couple of other symptoms that are attributed to maybe thyroid. It's important to note that PCOS can show up in people differently, but you do need to reach the 2 out of 3 diagnosis or symptoms for it to be counted as PCOS or to be diagnosed as PCOS. Hair thinning on your scalp or excess hair growth on your body and face. This is what's called hirsutism, and I have this symptom. You can have weight gain or difficulty losing weight, acne, especially in the jawline, and sometimes fertility issues. Now, for the treatment for PCOS, it's very difficult because it's still like it's not fully understood. Like we can't really say exactly one thing causes it. Now, for example, one lifestyle change you could do would be to like get on your diet and exercise regularly, which will help regulate your hormones. And I've noticed myself as well. I think this year I have gotten about, I want to say about 11 out of 12 of my periods, and this is because I've been the most active in my entire life this year. So my cycle and my hormones have been like balanced, and I don't want to say fully balanced, but it has been like I've managed my symptoms well. Birth controls can also help to improve the symptoms and regulate your periods, as well as to reduce androgen levels. There's also metformin. Metformin is a diabetic drug. It can be used for insulin resistance. Insulin resistance is a symptom as well of PCOS. If you suffer from hair issues and you don't like it like myself, you can do laser hair removal, electrolysis, or you can also take a medication called spironolactone. This is a diuretic drug, and this is used to block androgens. Now, for my personal journey, I have started doing electrolysis from, oh my god, I have tried everything. I think I used to do a hair removal cream. I have many videos, I think might be pirated now, I'm sorry. But I have many videos where I've talked about like, or I've shown myself doing hair removal for my neck. I've done waxing. I think I did threading like a couple of times. A friend of mine at the time helped me with this. So I've done waxing, threading, hair removal, and I'm like, okay, I need something permanent. When I was thinking about a level up for hair removal, I first went to laser, and the more I was researching and like looking on like, all the forums and like looking on Reddit and like I think Facebook and all the groups of what other women like myself have that have PCOS are talking about with hair removal, I found out about laser treatment, and I found out about electrolysis. Now, laser is a little less expensive than electrolysis, but it is still expensive. Electrolysis is quite it's quite expensive, but I think this is the only FDA approved hair removal treatment for all skin types and all hair types. It doesn't matter what color your skin is. The probe, the basically how it works. I'm gonna explain in a second about how electrolysis works, but electrolysis is the only permanent FDA approved hair removal method or treatment. Before I continue to talk about my hair removal journey as I've just started it, I would just like to say that with PCOS, you do not have to feel alone, because PCOS is, oh my God, it is something that a lot of people, a lot of women, it's obviously often misdiagnosed or undiagnosed as well. Um, but it's important to note that you're not alone. Like, there are other people who are going through this. If you need to find a community, find it in whatever shape or form that feels like to you. I think I have followed like a Facebook group, and I'm also following a couple of like subreddit pages, or I don't know what they're called, but pages on Reddit. I also follow a couple of people who help with like the with PCOS. So I think I follow like, there's a doctor, there's a man, I forgot his name, but there's a doctor that talks about like what you should take. For example, like I think he talks about like carnitine and like all the different medications and all of that, which I think I started taking carnitine, and they also talk about different supplements, but my thing with supplements is that I am not very consistent with taking them. So for example, with like vitamin D's and like all the other ones, I'm not very confident. I'm not very like consistent with taking them. So I try not to. I'm trying to do one thing at a time, and like focusing on like either like trying to be more active or something else. But I cannot. I'm not a consistent person when it comes to medication. I've never been, and even like when I'm sick, I hate taking medication. I'll just rather like, if I'm really really sick, or if I have a headache, for example, I'm just gonna ride it out. I'm gonna thug it out until it's gone. But if I have things to do, I'm gonna pop a pill or like take paracetamol or something. But I'm not the best or the most consistent person with medication. That's why I've not taken or started taking any. I think the most I've done is the L-carnitine and vitamin D. I mean, we all need to be taking vitamin D. But I think L-carnitine, I take that sometimes when I think like 30 minutes before I work out, and that's about it for medication. All right, so now I'm going to tell you and walk you through the process of electrolysis. I have recently went on an appointment. My last appointment was last week. You should technically be going every 2 to 3 weeks, but I do not have the money like that, so I just go once a month when I can. Now, what is electrolysis? Electrolysis is a hair removal technique that allows an ultra-fine probe or needle to deliver a small electric current into each hair follicle. This destroys the follicle and prevents the hair from growing back. Like I said, it is the only FDA approved method of permanent hair removal for all skin types. Not waxing, not laser, not threading, not hair removal cream, electrolysis. This is a big deal, I think. I feel like this is a really big deal. Now, how does this work? The electric current targets the hair follicle at the roots, depending on the type of hair and your skin. There are three methods that I could use: either chemical destruction, thermolysis, which is basically heat destruction, or a blend of both. Now, each session treats individual hairs, so it's precise, but it is time consuming, hence why it's expensive. Now let's talk about the pros and cons about electrolysis. It is permanent. It can permanently remove your hair. Also, again, unlike laser, all hairs, all skin type, like electrolysis, because of the method of treatment, it affects like any skin type, and any hair can be removed with this method. It's also very versatile. You can use it anywhere. You can make your face, you can do underarms, you can do your chest region, even down there if you really need to, like your bikini line and your legs, whatever you want to do, it can be targeted. Now, there's no maintenance. I mean, like whilst you're doing your treatment, there is a couple of things you should do. Like my esthetician, she has told me that between treatments, I should be shaving with a razor, and I should also be using like a what's it called, a scrub to like cleanse the skin so that there's some dead like cells and everything are removed, the dead skin and everything are removed from there. And I think she also said I should put like a face mask around my neck as well. And that's what I've been told to do by my esthetician. Now, like we've been talking about electrolysis, we've just talked about the pros. Let me tell you about the cons. It is time consuming. You're literally going individual, every single hair individually going to remove them. So now that's going to take some time. Now I think the cheapest or the least you can do is 15 minutes, and it goes up. And literally whenever I want to go, she's like, it depends on you, how much time and how much money you've got. That's how we're going to count this. Now, it's not the most uncomfortable or comfortable process. It's like, I think when I first started waxing, waxing was very painful for me. But I did waxing, I've done waxing a couple of times, and I've also done a couple of treatments now with electrolysis. And electrolysis it's a little bit painful, but I think it all depends. Like for example, when my esthetician, when she does it, like here I don't feel a lot of pain, but here I do. I think here because I sleep on this side of my face, which we're not really supposed to be sleeping on our side, like on our faces, but like when I sleep, sometimes I sleep like this and I sleep on this side of my face. So here is a little bit painful. Also on the day of your treatment, if you have some tooth pain or something, that area is going to be a little bit tender and like a little bit more painful than the other areas. So I think my first time I did my treatment, I had here was completely fine, and here was I had tooth pain that morning, and also I sleep on the side of my face. Now it is time consuming, therefore it is expensive. So yeah, I think for one treatment I get done, I do about 30 minutes. No, I do about 45 minutes, and I think that's about 1,800 crowns. I'm gonna have to do the math and put it whilst I'm editing. But yeah. Now your skin is going to be very sensitive after doing this, and literally like it's going to like kind of blow up. So not like blow up like this, but it's going to be a little bit swollen around the areas that has been worked on. And usually whenever you're doing it, it goes like this, like this. Like she does it more, my esthetician, she does it like this, and she does it like this, and then the next time it's like this and like this. Now, I think I have managed to do all of this so far, and she's also managed to do all of this so far. Now, I think we're going to be working on here. But obviously, like, because we're not completely done with everything, and also our hair has different growth phases. We have anagen, catagen, and telogen. I think I'm not sure if I'm wrong, I'm going to put the right thing here. But she focuses mainly on, I think, catagen because that's the middle phase of your hair growth. I believe, I cannot remember from dermatology from last year, or was it 2 years ago now? So you're gonna experience some redness and swelling, but these are very temporary. Like when I'm done with my treatment, I get zinc because of the anti like inflammatory aspects of the properties. So I get zinc, and she puts zinc all over here, like my entire my chin. And then she tells me to make sure I wear my sunscreen. Like I have to wear sunscreen around my neck to protect it from the sun because it's very very like sensitive. Now, I'm not going to tell you what to do. I think you have the capacity and you're very, very smart if you've been diagnosed with PCOS. Use like the internet, go on YouTube, go on like the Facebook groups, like I told you, and find information, find whatever is available to you. Now, electricity is kind of expensive. I'm not going to tell you go and do it, but if you want to do it, I think it's something that you should maybe save up for or something. But if it's something that you want to do, I think it's good so far. I think I'm gonna in a few months I'm gonna do another video and talk about like what is happening and like maybe show you some progress pictures and all of that. But at the moment I can say that it's good, and I have been I don't want to say it's worth it because I have not done enough treatments to say yes, it's worth it. But if this is the only FDA approved method of permanent hair removal, sign me up. But yeah. Now, I have been struggling with PCOS since I was 13. I am 24. I am nearly halfway through 24, and I think that let me talk about quickly about like my experience with PCOS. I didn't really take this very seriously. I'm not going to lie. This is me being very honest. When I was diagnosed, I was like, okay, I'm not gonna have my periods for a couple of months of the year. Like, what's the big deal? And the older I get, not that I'm here like thinking about like getting like having a child at any time, but there's so many issues like complications that come with it, and I'm a little bit worried. And also I've had a couple of bad experience with doctors, so I've been trying to like figure out myself, like my life by myself, my life like my body by myself. And this year I kid you not, I think I have seen 12 months, not 12, it's 12 months in a year, and about 30 I think I've gotten about 10 to 11 periods of the year. This has never happened to me before. I've never gotten my period like this often since I was 13. And I started my period when I was 10. There'll be years where I'll just have my period for like 2 months of the year. So like this year I've been the most active, I've been the most consistent with like my food and everything. Like I have fallen off so many times, but I've been able to bring myself back. So I think that if you've been diagnosed, please just take it slow. Do not beat yourself up. Like, it is not a death sentence. Also, because of the way PCOS is, I think when I was studying gynecology, I found that it's hard to know which one comes first. Does obesity come first before PCOS, or does PCOS come first and then like because of the insulin resistance? Does that like is a cycle? Like, is it PCOS first or is it obesity? But whatever it is, it's a cycle. And this is hard as well. Like, you just have to be patient with yourself and just know that it is a lifestyle, it is your body. Like, this is your vessel. Like, you just take care of it as much as you can, and just be patient with yourself. Like, you live with yourself, like no one else has to live with you. You have to live with yourself. You have to decide like how much or how little. But I think the biggest thing is to be patient with yourself, and do not let people bully you into different things. I have been asked a couple of times to do bariatric surgery. I've been asked to do like all manner of things. I was even put on metformin the first time I got diagnosed, and it did not agree well with my body. And I'm sure if I stuck with it, I'm sure it would have been fine. But I was not, like I said, I'm not someone that's very consistent with taking medication. So I just need to make sure I don't really need medications in my life. But anyway, this is all I have to say about PCOS. I'm sorry for the lack of vlog for last week, but I think maybe this video will maybe make up for it. I'm just trying to, I don't know, really know where I want to go with my channel like these days, but I don't want to be like more medical. I don't want to be like 100% medical. I don't want to be 100% like a certain thing. I think I have a lot of interest, and I just want that to show like on my account, because I like producing content, I like making content, I like taking content, I like content. You know, in Gilmore Girls, where it's like coffee, I'm content. And I just like I want to find a balance with all of my interests and just show on my vlogs, on my videos. So I have been finding it hard with like my account and like my social media in general. But anyway, that's not the point of this video. But anyway, I think we've now come to the end of this video. I hope that I don't edit this to be too long, but if I do, I hope you've stuck to it. And if you have, please comment down a heart. If you see this part of the video, comment down a heart, and I'll know that you stuck to the end of the video. You can find me on Instagram, on TikTok at IMJCharles. I think my TikTok is currently private because I'm like on hibernation. I'm trying to remove some certain videos on my account, and like, yeah. But anyway, thank you so much for watching, and I hope that this video does well. And if you guys are like recently diagnosed with PCOS and are looking for community, please comment down like what's been helping you with it, and like what your experience with PCOS is. So yeah. All right, bye guys, I'll see you guys in my next video.